this?
Yes.
Hi, what do you prefer?
Steve's fine.
Steve's fine. My name's Rachel. I'll be the student nurse practitioner working with you today. How are you doing?
I'm doing good, thanks.
Okay. So what brings you in today?
Yearly physical.
Okay. So before we get the exam started, I'm just going to go over a few questions, medical history with you, if that's okay.
Sounds good.
Okay. Are you having any pain today?
No.
When was your last complete physical?
About a year ago.
Okay. How about dental exams?
A couple months ago.
All right. And then do you wear contacts or glasses?
Both.
Are you going to regular vision checkups?
I do, yeah, about 2 months ago as well.
Okay. Let's go over your medical history.
Really the only thing is high cholesterol.
Any surgical history?
No.
Recent hospitalization?
No.
So we're going to go over your family history next. So let's start with your parents.
My dad has high cholesterol and high blood pressure, and my mom had Graves' disease.
How about your grandparents?
On my dad's side, my grandmother's healthy. My grandpa passed from a heart attack in his 80s. And then on my mom's side, my grandpa was healthy, and my grandmother passed away from colon cancer.
Do you have any children?
I do not.
What do you do for work?
I'm a contractor.
Any tobacco use?
I used to smoke.
How often?
I smoked about a pack a day for like 10 years.
And when did you quit?
About 2 years ago.
Okay, that's good. How about alcohol use?
A couple beers a week, maybe, if that.
Any recreational drug use?
No.
Any recent travel?
No.
I know you said you're a contractor. Have you been exposed to any toxic substances or environmental hazards, lead or asbestos?
I don't believe so.
Any medications that you're taking?
I take Lipitor for my cholesterol.
And that's been working okay?
Yes.
Any over-the-counter or herbal supplements?
I take Tylenol if I have pain.
Any allergies that we need to know about?
Not that I'm aware of.
And then how about immunizations? Are you all up to date on your immunizations?
I believe I am, yes.
Okay. So we're just going to go over a couple more questions and then we'll get the exam started. So have you been having any fevers or chills at home?
No.
Any difficulty sleeping?
No.
Any recent weight loss or weight gain?
No.
Okay, while we're on the subject of weight loss, weight gain, how's your diet and exercise at home?
Pretty good because of my cholesterol. I try and exercise a few times a week, and I eat lean meats, a lot of vegetables and fruit.
Okay, good. Any recent changes to your vision or hearing?
No.
Okay, blurred vision, double vision?
No.
Any difficulty swallowing?
No.
Any heat or cold intolerance?
No.
Any increased thirst, frequency in urination?
No.
Any chest pain, palpitations?
No.
Fainting, dizzy spells?
Also.
Okay. Any shortness of breath, wheezing,
Mm-mm.
persistent cough?
Nope.
Okay. Have you been having any difficulties at work or performing any activities, day-to-day activities?
No, not at all.
Any weakness, numbness, tingling anywhere?
No.
Any nausea, vomiting?
No.
Constipation, diarrhea?
Nope.
Okay. Changes in urine frequency, burning with urination?
No.
Okay.
Good.
Okay. Any headaches at all? Tremors?
No.
Muscle spasms?
Nope.
Okay. And then, how have you been feeling at home? Any changes to your mood?
No, I've been good.
Anxious?
Not at all.
Depressed? Okay, so we'll get the exam started. If at any point you need me to stop or have any questions, just let me know.
Okay, sounds good.
Okay, and I'll explain what I'm doing as I'm doing it.
Okay.
Yeah. Okay. I am going to start by just looking over your skin.
Sure.
So I'm just going to touch. So your skin's warm, nice and dry and pink. I don't see any lacerations or lesions anywhere. Have you had any dry patches that you've noticed?
No, I haven't.
Okay. So no signs of eczema. So I'm just going to take a look at your scalp.
Okay.
So you have a normal hair growth pattern. No signs of flaking. No lesions to your scalp. Everything looks good.
Okay.
Going to take a look at your eyebrows here. Again, normal growth pattern. No flaking. No edema, no redness anywhere. Your eyelashes have a normal growth pattern as well. No flaking either. The conjunctiva of your eyes, they're nice and white. I don't see any signs of jaundice, like a yellow color. There's no signs of hemorrhaging anywhere. So everything looks good. So what I'm going to do next is we're going to do a couple vision tests.
Okay.
Just to kind of take a look. So what I could do to test your vision is use what's called a Snellen eye chart to test cranial nerve 2, make sure your vision's intact, but there's no changes to your right or left eye. So we would use that. Next, I'm going to take a look at cranial nerves 3, 4, and 6, which is just taking a look at the movement of your eye.
Okay.
Making sure everything looks good. So what I'm going to have you do is just follow my pen first.
Sure.
I'm going to bring it inward.
Okay.
And that's testing convergence. And then I'll have you follow.
Okay.
Good. Okay. So I'm going to shine a bright light in your eyes. Good. Good. Pupils are equal and reactive. That's a normal sign. So the next thing we would do is we would do what's called an ophthalmic exam. So I would shine another light in your eye just to take a look at the back portion of your eye. I would want to make sure that I can visualize an optic disc, that your retina is like a reddish orangish color. That would be normal. And then the blood vessels in your eye as well, making sure that there's no signs of hemorrhage. But you said you have no vision difficulties, so that's good. So we're going to move on to your ears next. So I'm just going to take a look at the outside of your ear. Everything's soft. There's no signs of edema, redness anywhere, no pain at all in your ears. That's fine. No lesions anywhere. So I'm going to take a look. I would use an otoscope to look at your auditory canal. And then I'm going to look at just your external canal. So what I would do is pull your ear up and back to get a better look. In the auditory canal, we would be looking for your tympanic membrane, which is should be a nice pearly gray color. Something else I'd want to keep an eye out for is any signs of excess cerumen or excess wax. Any kind of redness or inflammation inside of the ear can indicate an ear infection or otitis media. So what I'm going to have you do next is we're going to test cranial nerve 8. That's just to test your hearing. So I'm going to have you plug one side of your ear for me.
Okay.
And I'm going to whisper a word and I want you to tell me what it is.
Okay. Apple.
Good. I'm going to have you plug the other side.
Orange.
Good. So if you were unable to hear me, we could do a series of tests called the Weber and Rhines test to further assess hearing loss. Okay. So next I'm going to look at your nose. So I'm just going to look at the outside. Your skin looks good. There's no lesions, no swelling, no redness anywhere. Look at the nares. Good. There's no drainage from the outside. So again, I would use an otoscope to look inside of your nose. So your membranes in your nose should be a nice pink, moist color. There shouldn't be any excess drainage. redness, irritation. If you did have chronic allergies, the tissue would be a bluish hue, but I don't see any signs of that. Okay, so I'm going to just take a look at your sinuses. So I'm just going to touch a couple areas on your face. I want you to let me know if you're having any pain when I touch. Okay, so this is your frontal sinus. And this is your ethmoid sinus.
Nope.
Good. And this is your maxillary sinus.
Nope.
Good. Okay, so we'll move on to your lips next. So the outside of your lips look like a nice healthy pink. No lesions, no sores anywhere, no skin breakdown. I'm just going to take a look at the inside of your mouth.
Okay.
We'll look at your teeth first. Everything looks good. No signs of any dental caries. So make sure you keep going to your frequent dental appointments because they look good. Have you stick out your tongue for me and say ah. Good. So a couple different things. Again, the buccal mucosa or the membranes inside of your mouth should also be a nice pink, moist, which everything looks good. We tested cranial nerves 9 and 10 when I had you stick out your tongue and say ah. The uvula at the back of your throat should be midline, should rise. I'll have you stick out your tongue one more time and move it back and forth side to side. That's testing cranial nerve 12. So if your tongue were to deviate to one side or another, that could indicate a lesion on that cranial nerve. Okay. So a couple different things before we move on. I'm just going to test a couple different cranial nerves here. So I'm going to test cranial nerve 7, which is the facial nerve. So I'm going to have you raise your eyebrows for me. How about your cheeks? Good. Smile for me. Nice. Okay. And then we'll test cranial nerve 11 by shrugging your shoulders. Good. And last one, I'm going to have you close your eyes. I'm going to touch an area on your face. I want you to tell me where I'm touching.
Forehead. Right cheek. Left chin. Left cheek. Right chin.
Good. And that's just testing the trigeminal nerve, which is cranial nerve 5. There's 3 different branches, so just testing each area. Okay. So what I'm going to do next is I'm going to have you actually kind of to the side here a little bit. So I'm just going to take a look at all of your lymph nodes. So they should be soft, non-tender. So if you do notice any tenderness, that could be a sign of some kind of infection going on. So I'm just going to take a look there. Okay, so we have your preauricular, postauricular, tonsillar, submandibular, your submental, your superficial cervical, posterior cervical, and then you have a supraclavicular. Okay, everything feels good. So next I'm going to take a look at your thyroid. Okay, so I'm going to feel a little awkward. So I'm just palpating, making sure there's no nodules anywhere. I'm going to palpate the body, the isthmus, and the lobes. Just kind of move it back and forth. And then I'll have you swallow for me. Good. Okay. So next we'll move on. I'm just going to take a listen to your heart and lungs. We'll start with your lungs. Just want to kind of take a look. Your breathing looks good. You said you had no shortness of breath. You're not using any accessory muscles. If you were to have any difficulty breathing, obviously, that's something you'd want to come in for. So I'm just going to listen to the front side, and then we'll do the back side. Take a nice deep breath in. Sorry. A couple more times. One last time. Okay, and I'm just going to kind of have you turn to the side here while we'll listen to the back. A couple more times. Last one. Good. Your lungs sounds clear, which is good. So no signs of any wheezing, any adventitious breath sounds, which is something we want to keep an eye out on. So next I'm going to take a look at your carotid arteries. So first I'm going to touch either side. Good. Good. Nice and strong. And I'm just going to take a listen. Good. So especially with your high cholesterol, something we want to keep an eye out for is in your carotids. You want to make sure that there aren't any blockages going on over a period of time that can cause a stroke if there's some blockages. So that's something we'll want to keep an eye out on later down the line. Well, it can happen at any age, but later on down the line too. So next I'm going to move on to your heart. I'm just going to take a listen there. Okay, so we're going to listen to your aortic. Secondary pulmonic. Your tricuspid. Your lungs sound, or excuse me, your heart sounds are nice and regular. I don't hear any signs of palpitations or regular heartbeats. Okay, so I'm going to just take a look at your chest wall here. I'm going to feel around for your point of maximal impulse. And what we're taking a look at here is making sure your heart's in the right spot where it needs to be. That we don't have a sign of cardiomegaly, which is a sign of an enlarged heart. Okay, good. Feels right where it needs to be. So next I'm going to do is take a look at all your pulses. Okay. So we'll start at the top here. So your radial pulses, your brachial pulses. Okay, and then I'm actually going to have you lay down so we can get this bottom half here.
Okay.
So we have your dorsalis pedis pulses, your posterior tibialis. Check behind your knees here. You have your popliteal pulses. Good. And then, all right, I'm just going to check your femoral pulses here as well. Good. Everything's nice and strong. 2+ all around. So I'm just going to take a look at your stomach here. So the first thing I'm going to do is just going to listen. You have nice normal bowel sounds in all 4 quadrants. You haven't been having any issues with bowel movements. Everything's been regular.
It has, yes.
Okay, good. So the next thing I'm going to listen for is to check for any bruise. Make sure there's no issues with your vasculature system here. So everything sounds good. There's no signs of any irregular or abnormal blood flow. The next thing I'm going to do is just kind of touch your stomach. I'll do a light touching at first, and then we'll move on to a little bit of a deeper. Okay. pushing here. Once you let me know if you're having any tenderness anywhere.
Okay.
Pain at all?
No.
Good. So I'm going to go a little bit deeper. Good. Okay. Any pain at all anywhere?
Not at all.
Good. Okay, so I will have you actually sit on the side of the bed.
Okay.
I'm going to show a couple different parts of the exam. So we're just going to do neurological assessments. So
Sure.
I tested a couple of your cranial nerves earlier in the exam, so we don't need to test those again. So the next thing I'm going to do is actually have you stand up for me.
Okay.
We're going to do some walking.
Okay.
To check your balance and posture, making sure everything's equal on both sides. So I'm going to have you walk across the room for me. Good. Okay, so the next time you go back, I'm going to have you do what's called tandem style. So you're going to walk one foot in front of the other.
Oh, okay.
Good. Okay, and then I'll have you walk on your toes coming back. Good, and then walk on your heels. Good. Okay, so you can come back this way. So something we want to keep an eye out for is if you're starting to have any weakness on one side, any numbness or tingling as you're walking. That's something we want to keep an eye out for. Okay, so I'm going to have you close your eyes. Okay, and I'm just going to kind of watch it for a second, and I'm going to perform what's called a Romberg's test, making sure that you're not swaying back and forth. This is just a way of testing your cerebellar function, which appears intact. That's just a different part of your brain.
Okay.
Take a look at. Good. So I'll have you sit down. Got a couple more tests to do. All right. So what I'm going to have you do next, we're going to test some coordination.
Okay.
So I'm going to have you take your finger, touch tip of your nose, and then touch my finger. Good. 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 All right. And then I'm going to have you put your hands on your thighs, flip them back over, and then I want you to do that as fast as you can. And that's what's called rapid alternating movements. Good. So next thing we'll have you do is this. Have you lay back in the bed again for me.
Okay.
So I'm going to have you take your heel on this side and put it on this leg.
Okay.
And drag it up towards your knee. Good. And then I'm going to have you do the same thing on the other side. Good. So there's no signs of ataxia anywhere. There's no dragging. Everything appears normal. There's no signs of any irregular muscle tone that I'm noticing, any tremors or spasms going on, or irregular movements. So the next thing I'm going to have you do is close your eyes again for me.
Okay.
I'm going to touch a couple different areas, and I want you to tell me where I'm touching.
Okay. Left arm. Right hand. Right arm. Right foot or leg. Left thigh. Right thigh. Left foot.
Good. Excellent. Okay. So next thing I'm going to do, sorry to have you keep getting back and forth. So I'm going to test your deep tendon reflexes, making sure that your muscle tone is okay, that there's no signs of overreaction with the muscle or underreaction with the muscle, because that can indicate some nerve damage.
Sure.
Okay. So we're going to start with your brachioradialis. All right, and then we'll move on to your bicep. Yeah, just like that. And then your tricep. Good. And we'll do the same thing on the side.
Okay.
Brachioradialis. Good. Bicep. Oh, you're good. And tricep. Okay. And then we'll move on to your patellar reflex. Sorry. Good. Okay. So the last thing we'll do is just we'll test your strength of some of your muscles.
Sure.
And I think we'll be kind of all set here.
Okay.
So what I'm going to have you do is hold your arms out in front of you. Don't let me push them down. Good. I want you to push down against my hands. Good. Okay. I'm going to have you bend your arms up like this. I'm going to pull them forward. Don't let me pull them forward. Good. Don't let me push back. Good. Okay. Squeeze my fingers. Perfect. So I'd say 5+ on both upper extremities, so equal strength, equal muscle tone, symmetry to the muscles, equal contour. So then while I have you here sitting up, I'm going to have you try to lift your leg up for me, push against my hands, don't let me push down. Okay, same thing, don't let me push down. Good. Okay. Last but not least, we'll have you lay back down in the bed one more time. Yeah, have you lift your leg up for me, don't let me push down. Good, I want you to push down against my leg. Good. Alright, well, lift up your leg on this side, don't let me push down. Good, and push down on my leg. Good. And then push down on my feet, like, or my hands, like you're riding a bicycle. Good, okay. So again, lower extremities, muscles are equal, 5+ bilaterally, no signs of any spasms, involuntary movements. The contour and symmetry of your muscles are normal. Okay, so I'll have you sit back up for me. Everything looks great. I didn't see any abnormalities on your exam, so everything looks good for this year. So we'll have you follow up again next year. If you have any issues in the meantime, you let us know.
Will do.
Any questions for me?
No, thank you very much.
Okay, perfect. Nice to meet you.
Nice meeting you as well.
All right, and that completes the physical exam.